Senior medical students, congratulations, your rank list is in. I hope you all match at the program you desire in the specialty you have chosen. But what if you don't get the good news? What if you don't match? I'm Dr. Martha Terrace, Chair of Urology at the Medical College of Georgia, and here to talk about that hopefully far-flung idea of not matching. There are three main reasons people don't match. Number one is that they did not apply broadly enough. You may, in your heart of hearts, want to stay in one region of the country or stay in the city where your significant other has a position, or any number of other reasons that you limit your application. Maybe your application is really, really strong and you're sure one of the top programs in the country is going to match you, and you don't list enough safety programs. So you have to play the game. You have to apply broadly. You have to list less competitive programs. They're not bad programs. The ACGME polices the quality of the programs quite stringently. So there's no such thing as a bad program. It may not be in the city you like. But you have to ask yourself, would you rather be a practicing physician in your chosen specialty or not match? So think about that when you're applying again, and also when you're in the scramble, because you can't be picky. Another reason, probably the most common, is your application isn't very strong. You struggled with some grades in med school, you didn't do well on the steps, you may have a couple of letters of recommendation that aren't as stellar as you thought they'd be. So that sort of thing you can improve by doing a research year. Go to a different institution, don't stay at the same institution, so you've got some other people providing letters that you've won over in a year's worth of work with them, and crank out some publications and some presentations that will make your application look amazing. That can make up for a slightly lower step score. It won't make up for a terrible step score. But it will make up for slightly lower than average for your specialty. Then the final group is the group whose application looks good, who apply broadly, but don't interview well. These are the people who may be a little immature, who may be a little unprofessional, who may come over unintentionally as unenthusiastic about the program, or maybe too enthusiastic, awkwardly so. Let's face it, we're all awkward. I mean, we've been overly educated and stuck in institutions of higher learning most of our lives. So some degree of nerdiness is expected among applicants to medical programs, but you can be too much, obviously. So in that situation, if you think that was your problem, that you just didn't interview well, probably doing an internship somewhere, matching in an internship to get some professional polish, to get some hard life under your belt, to mold yourself a bit into how you're supposed to behave when you're talking to patients. And I'll be honest with you, we as faculty members, we don't mind a quirky resident. You're delightful. But we do mind if you're going to scare our patients because you're a little too odd. So think about how your personality is coming across to your grandmother, right? I mean, not your grandmother, but somebody else's grandmother. And how would they appreciate their doctor acting? And act as if you were talking to somebody's grandmother when you put on your professional persona, because you're going to have to do that your whole life. Unless you go into a hospital-based specialty that doesn't have patient contact path, radiology, then that's going to you're going to have a professional facade of some degree, even though we love you quirky. So think about those things. Think about what got in your way of matching successfully when you think about going through it a second time.